Lulani, are you going to do virtual background for the Q&A?
Yeah, I can. I can do that, but I was looking for that background that you guys are displaying there, and I couldn't find it. I know it's somewhere, but I don't remember when was it sent. Yeah.
Let me just forward it again.
Because there's I've seen people directing emails that should be directed to me via the Cyril Ramaphosa email to Black Umbrella's email as well.
Yeah, I see people coming in.
Yeah, I think, yeah, there's a lot of people that are there, yeah, that are coming in, and I'll let them in, and then as I'm letting them in, I'll be sharing the program. So I'm not sure if we still, I think we'll still see how many people are coming through as we wait for time. But you can indicate to me whenever you're ready to start, Alice.
Yes, I see there is 9 now, and it's almost 4:30. So I don't know if we want to maybe just for 2 minutes, and then we can start, because remember we said we don't want to keep people waiting. So we'll start at around 16:32. Is that fine?
Yes, yes. I think that should be fine. And greetings to all the other people.
Sazi, did you win with the virtual background?
No, and I don't think I've got enough time to go and get it. It's fine. I will continue in this fashion.
Fine, Sazi.
No problem. No problem at all.
Yeah, so we are currently live on Facebook as things stand. Yeah, we have started, and yeah, greetings to everyone joining on Facebook, and yeah, we'll admit people and wait for more people to also join. But yeah, other than that, yeah, enjoy.
On the 16th, he had spent the night at your house. And what happened? He got off work and we drove in his truck.
And we all mute our mics.
And we left his truck there, rolled my car home. I asked him if he could drive a little faster because we had our daughter in the back seat that was tired. And he said,
"Are you able to mute everyone, Senzo?"
I said no. So he swerved into Super America, slammed his brakes, called me, and
that's not true.
Screamed at me from Super America the whole way home. I had a spare.
Good evening, everyone. Thank you for joining us. My name is Alice Moyo, and I am your program director for the evening. Like I mentioned, my name is Alice Moyo, and I am with the Cyril Ramaphosa Education Trust. Thank you so much to everyone who's taken time to join us on this very important webinar where we are going to be talking information around COVID-19 and COVID-19 vaccines. Something that has come over and taken over our lives, you know, in the split of a second, and we're all trying to figure out what this new world means. And we just thought it's very important to engage with the youth and hear what your thoughts are, but over and above everything, just encourage each other to go and get vaccinated. I was listening to the news the other day, and they were saying that the number of people getting vaccinated is dropping each day, but we are far from reaching herd immunity. So we are hoping to have an open discussion with all of you today, just to discuss what your fears are, what the myths are, what misinformation is there, and hopefully by the end of this webinar, we are all well informed and ready to go and vaccinate. So like I mentioned, we'll be having an open discussion, but before we start, I'm going to go through the house rules for this evening. You will notice that you were automatically muted and your camera switched off when you joined, and we're just doing this to minimize background noise and any disruptions. However, please do engage in the chat box. If you're joining us from our live streaming on Facebook, please do comment in the comment section because we want to have a very engaged discussion. We have a very special guest this evening. His name is Dr. Sazi Nzama. Dr. Sazi is a medical doctor. He's also an alumni of the Cyril Ramaphosa Education Trust, and he holds a Bachelor of Medicine and Bachelor of Surgery from the University of KwaZulu-Natal. Dr. Nzama serves as a non-executive director and chairperson of the Constitutional Matters Committee at the South African Medical Association. He is also head of the Psychosocial Support and Social Affairs for the Cyril Ramaphosa Education Trust Alumni Advisory Board. Besides Sazi, we also have other special guests that are going to be speaking to you later on, so please do stay tuned. But for now, I'm going to hand over to Dr. Sazi.
Hi. Hi, Alice. Thank you so much for the introduction. Hope everybody can see me. Thank you so much for coming, and thank you so much for taking out your time to attend. We're going to go straight into it and discuss a few things about coronavirus itself. But what I want to spend a lot of time doing with this presentation today is just to run through the information that we've received about the Johnson & Johnson vaccine as well as the Pfizer vaccine, and clear up some misconceptions that have been given about those two specific vaccines so that you are better informed about what's happening and what you're getting yourself into, as well as what to expect. I'm also then going to just touch briefly on the information that's been circulated in the media and correct the misconceptions that have been created by the media. The intention behind this is obviously then so that when you are with your friends and you're talking about it and with your family as well, you have factual information that you can tell them about and you can dispel myths around COVID-19 and the vaccination, the vaccine itself and the vaccination process. This will then allow you to, one, have factual information, but two, to put people's minds at rest, as well as put your own mind at rest when it comes to vaccinating. Alice, if you'd mind just giving me permission to share my screen, and we'll get straight into it. Oh, lastly, at the end of it, afterwards, I'm going to then give a platform to everybody in the group. Hopefully, Genilo and Alice are monitoring the Facebook as well, and in the comments we'll see what's happening there, and we'll take some hands from our participants here to see, and then we'll answer what questions you have in order to assist us in getting more knowledge and dispel the myths around COVID-19.
Great, Sazi. Please check if you're able to share now.
Yeah, looks like I am.
Perfect.
All right. Good. We can all see that. That's perfectly fine, yes?
Yes, thank you.
Fantastic. So as it's been said, my name is Sazi Nzama. I am a medical officer currently working in the Pietermaritzburg Circuit in Bungundlovu district in KwaZulu-Natal. I've worked previously actually trained in the circuit in Durban, and then worked for a few years in Bloemfontein. After that in the Western Cape in a tiny town called Caledon, which is about an hour and a half outside of Cape Town. And from there, then I've come back to then pursue my dreams and my passions, starting out in the Pietermaritzburg circuit. So today we're going to be talking about COVID-19 and the vaccination process. So briefly, just to outline what we're going to talk about, I want us to touch on very quickly on coronaviruses and give you some information about coronaviruses themselves and what they are, how they work, how they're transmitted, and what the symptoms are, how they're treated. And then we'll go on into the bulk of the presentation, which is the COVID-19 vaccine, where we'll talk about how it works, what the actual goal of vaccinating is. I'm going to then touch on briefly on the Pfizer-BioNTech and the Janssen, which is produced by Johnson & Johnson vaccine. I'm not going to focus on AstraZeneca and Moderna or the Sputnik vaccine, even though those names will show up in there. I'm only going to focus on the two vaccines that we currently have available in South Africa. Hopefully by then I will answer the two major important questions that we have been receiving from people, which is which one is better than the other and which one should you take. We'll then look at the side effects of the vaccines, and then we'll open the floor for questions and answers as we go along. So what are coronaviruses? I think that's the first most important thing. So coronaviruses are a large group of viruses. It's actually been around for a very long time, and they are covered in little spike protein, little spikes when you look at them under a microscope, which gives them the appearance of wearing a crown. Of significance, the word corona is Latin for crown, hence we get the name coronavirus. There are many different viruses or coronaviruses that actually exist in our world. There's more than 100 described types of coronaviruses. However, only 7 of them are known to infect human beings. All 7 of these are highly infectious and can cause some trouble for the individual who's infected. They are then grouped into 4 main classifications, and that is the alpha, beta, delta, and gamma groups. However, of significance is that only the alpha and the beta groups are known to infect human beings. Now, of these 7 types of coronaviruses that we have that infect human beings, 4 of them cause your mild symptoms, which is your sore throat, nasal congestion, or a runny nose. And the 2 of them then from there are then known to cause some respiratory problems such as coughing, shortness of breath, and pneumonia. And the latest one, which is then number 7 that's known to infect human, is the SARS-CoV-2 virus, which then is a hybrid, and it is a cluster combination of both your mild and your very moderate and severe symptoms. Where do the coronaviruses come from? So they've been described for years, but they're known to infect birds and mammals. So bats are actually known to be the host of the largest viral genome of the coronavirus. So the other over 90 or so viruses, strains of coronavirus that exist, bats are known to be the largest host of that. So interestingly about this animal as well is that bats actually act as a host of coronavirus while themselves not actually being infected by or expressing or having symptoms of coronavirus vaccine. I've yet to see a bat that's coughed and dropped down dead because of corona. Perhaps we should consult a vet to see if that happens. But anyway, so how this then happens is that bats then can transmit the virus to other birds and other mammals. And like I said, their immune systems are able to suppress a lot of the virus, so they don't necessarily express it. Now, it's important then to mention that during this process of transmission from a bat to any other bird or to an animal or a mammal, such as a pig, your cow, your camels, the virus can mutate. The reason why it will mutate is for the virus itself to better adapt itself to interact with the cells of the host that it has infected. And this is how we then, it's one of the premises and one of the bases of how we keep having all of these mutations of the coronavirus happening. So the coronaviruses, we have had a glimpse of them previously in the past, where it presented themselves into 2003 in what happened in China with a respiratory syndrome that was first described as severe acute respiratory syndrome, but we all just called it SARS in 2003. In the 2012 and 2013 period, we had another outbreak that happened, and it was an epidemic that happened based in the Middle East, specifically in Saudi Arabia. And that one was called the MERS, the Middle Eastern Respiratory Syndrome. But these are all expressions of coronavirus. And then in December 2019, then a new type was discovered based in Wuhan, China, and presented itself as a pneumonia. And this one was then named COVID-19, which means coronavirus disease of 2019. Interestingly for you to note is that there are many animal hosts that can transmit the virus, because lots of pet owners will be asking themselves if their fish or their parrot can give them coronavirus. And what we do know about the 2003 SARS coronavirus was that the civet cats actually were identified as the host of coronavirus. And interestingly, in the Middle East in 2013, camels were found to be the animal host of coronavirus. For the novel coronavirus, COVID-19, scientists have yet to release data that tells us which is the animal host of coronavirus at the moment. So there is speculation, but we don't actually have concrete evidence to suggest which animal is playing the host at this time. So how is it spread, which is then where we go to. So remember, there's two ways in which the coronavirus will spread from person to person, and it all depends on our behavior. That's a very important thing to mention. The first route is the inhalational route, where individuals inhale droplets. So the respiratory droplets that we talk about are produced by an infected person through coughing and sneezing, and sometimes even talking, breathing. It can transmit these droplets. And what these droplets are, they're really microscopic. They're very tiny, they're very light particles that will sit in the air that you breathe for up to 6 hours, or sometimes even more, depending on the spaces that you're in and the ventilation thereof. Droplets then can settle. So that's the first way that you'll get it, is you'll breathe in these coronavirus infected droplets, particles that are in the air, and you then infect yourself with coronavirus. The second process that happens is after a person has coughed or sneezed or dug in their nose and they're infected with coronavirus, and they touch door handles, table surfaces, all these common things that we touch, even your cell phone as well. They then pass that virus on to that device, where it will play host for a couple of hours. And in certain circumstances and climates, it can even go up to a couple of days. So when that happens, you will then touch those surfaces, and how you will inoculate yourself is you will then, without washing your hands, you will touch your mouth, your nose, or your eyes and introduce the coronavirus into your system. So what are the symptoms that are described? I've grouped these into 5 major categories based on what we've received and the reports that we've had as to how people are presenting and what symptoms and signs they're having with coronavirus. It's important to mention before that is that all of these symptoms generally take 5 to 14 days for an infected person to present with the symptoms that we're going to talk about now. So it's very important to note that the first group of symptoms, which are the asymptomatic people, but still highly contagious, are the most dangerous individuals that you can have in this virus, because they will experience absolutely no symptoms and they will be walking around, and if they do not adhere to the protocols as strictly as they should, will not be wearing their mask. And if they cough or sneeze or rub their nose and touch surfaces, they will inevitably transmit the virus and infect other people. In the group that I've termed as systemic symptoms, the people that we have present with tiredness, weakness, they also present with headaches, and the most common one also that's been presented is a fever. From there, we move on to the respiratory symptoms, which are the most common ones that are described. And those are your nasal congestion. Your nose can either be blocked or runny, or a combination of both. A sore throat, a cough that may be wet or dry. You may have phlegm and produce phlegm, or it could just be a dry cough that feels like there's something in the back of your throat that you need to get out. That scratchy thing at the back of your throat is the coronavirus. Also, then people complain with shortness of breath, difficulty breathing, and a large majority in this instance of the coronavirus, people have presented with loss of taste as well as loss of smell. You remember that, or know that as an individual, when you do have a little bit of stuffy nose, people who suffer from sinusitis will know that if you do have a little bit of a stuffy nose or a blocked nose, it does sometimes tamper and hamper with your sense of smell, and it does hamper with your sense of taste as well. However, these symptoms are not necessarily permanent. They will remit as time goes on. However, the difference, it differs from person to person as to how long it will take. In the musculoskeletal category, we then have people have complained with having joint pain, unexplainable muscle pain, pain that is not congruent with what they're feeling. For example, they will feel like they have worked out or they've done leg day at the gym while actually having done no activities at all. Commonly, the ones that have been presenting from a lot of the people that we've had is that they complain of lower back pain. But then you have your joint pain and your muscle pain in this category. The last category we're speaking about is the gastrointestinal, which is your digestive system. People have presented with nausea, with vomiting and diarrhea. While these symptoms are a lot less common, it must also be, specifically noted that people who have these symptoms have nausea and vomiting and other symptoms long before they actually present with the respiratory symptoms that everybody is watching out for. So then what is the treatment of coronavirus? I thought it was important for us to have this slide and have a talk about it. There actually isn't a registered treatment for COVID-19 infection. Do not be mistaken. So there's been a lot of speculation and a lot of hoo-ha and people talking in the public about the use of ivermectin. There are studies currently going around about it, but there is no drug that is actually registered with the FDA or any other drug company to actually treat this novel coronavirus. It's very important to note that. But the principles of treating your coronavirus infection are: one, do not panic. It's very important for anybody who's infected with coronavirus to remain calm as much as you can. You must know that if you start to panic, you put yourself into a stressful position and your body will respond in that fashion by releasing stress hormones and overproducing hormones or underproducing in response to you panicking and being so stressed. So it's very important to remind yourself to stay calm at all times and rest. Sleep, rest as much as you can. I have to put it there as rest, and rest some more, because there's absolutely nothing more that beats you actually just going to bed, taking a nap as and when you need to do that, because your body is going to be working so hard in fighting the coronavirus. Your body also needs time to rest and recuperate. Even if you can't taste it, eat food. You need to tell yourself to eat food. It's important to do so because whilst your body is burning up and whilst your body is processing and is at war with the coronavirus internally, it is going to be utilizing a lot of your stores, a lot of your vitamins, a lot of your minerals that your body has stored away in attempt to battle and replenish itself and create more antibodies, create more immune cells for your body to deal and cope with the coronavirus. And then importantly after that is to stay hydrated. Very important is one of the things. So in terms of then treating coronavirus, you will treat it like you do the usual cold and flu that you have during the season. So what you will do, there is your preferred medical practitioner, your healthcare practitioner will give you medication that you require at the time. If you're coughing, a cough syrup might help you. If you've got a sore throat, your throat lozenges will help you for the pain. There are anti-inflammatories, there's Panado, there's ibuprofen, there's a lot of them on the market. You treat it as you will your normal flu. There isn't actually a remedy that works, that is specific for coronavirus. And I think that's the most important thing to know about this slide. So from then on, now that I've told you how coronavirus is transmitted, it then makes sense when you listen, when you now know, and you listen to what all of the adverts and the commercials from the NICD, from government and all of these entities have been saying about coronavirus is wash your hands regularly, because you don't know what surface you've touched that may harbor the coronavirus. So avoid touching your mouth and nose and eyes unnecessarily, because you are at risk of inoculating your own body with the coronavirus if it was on a surface that you have touched. And then sanitize your hands as frequently as possible, as well as your cellular devices and other devices, because they will touch infected surfaces accidentally, and you can inoculate yourself with coronavirus. Especially cellular phones are one of the most problematic, specifically in our generation, where we use them a lot and we have them in our hands all the time. And sometimes people make phone calls with your phone and so on and so forth, and you can then take that and inoculate yourself with coronavirus. The next thing you can do to prevent it is wear your face mask correctly. So now that we've mentioned that the droplets will be sitting in the air even after you have the person who has the coronavirus has left the room, they can linger in the room for up to a couple of hours, and that is then how you can then get infected. So wear your face mask, cover your nose, and that's the important thing about it, is you've got to wear your face mask correctly. So ensure that it covers your nose and it covers your mouth. It's not appropriate for you to protect your chin. Your chin doesn't need protection from the coronavirus. Your mouth and your nose do specifically, because that's where it's going to enter. So wear your face mask correctly. That's the very most important thing to do, and wear it at all times as much as possible where you are going to be around people, and people that you don't commonly interact with in the workplace, in the shopping malls. Even when you're walking on the street and you think that there's nobody around me, wear your mask. The coronavirus could be lingering in the air and ready to infect you. Then the last thing we do is then we practice social distancing. Remember that we spoke about just now how coughing and sneezing can transmit the virus into the air, but it can also project the droplets for up to 6 feet. So it's important, and this is why then we've then said practice social distancing and stay far away from each other, so that if you do have somebody who's asymptomatic, or you do have somebody who does not yet know that they have coronavirus and they cough and they sneeze in your vicinity, you are at least safe and you're far away and you're not necessarily going to get, it decreases the chances of you acquiring coronavirus. As much as humanly possible, avoid large crowds and avoid crowded spaces. And if you must enter those spaces, you must remember, sanitize frequently and keep your face mask covered over your nose and your mouth. So we get on now to the part of the presentation that everybody's been waiting for, and that is talking about vaccines. So for the purpose of this talk, like I said earlier, we're not going to focus on all of the other vaccines that are available in the world. We're specifically going to just touch a little bit on vaccines that are available in South Africa, which is the Pfizer vaccine, as well as the Janssen vaccine created by Johnson & Johnson. So before we then go on to why you should get vaccinated and so on and have that debate, I think it was important for me to let you know how actually the vaccine works and how it was created. So this is an important slide of the coronavirus unpacked. I've just highlighted what I want you to remember, and that is the RNA, which is the genetic material of the virus, and then this spike protein in the slide is called a spike glycoprotein, which is the actual crown-looking appearance that corona has, and how the virus actually interacts with the human being and gains access into the human body. So when we look at in the normal human being, we have a lot of cells in our body, and we have our genetic material, which is housed in what you've heard previously is DNA. So your DNA, to simplify it so you can understand if you're not a medical person, is that DNA think of it as a library that contains the original documents of who you are. Your DNA contains the codes, the sequences, the recipe book really as to how your body can make proteins, can make hair, can make cells, can make everything that you require in your body. So how this happens is that then when your body needs to make a specific protein, your body goes through an entire process where it creates an RNA, so a ribonucleic acid strand. And an RNA strand is pretty much, think of it as your body requires to make a protein, it goes into the library and it finds that specific thing that it requires to make and makes a photocopy. So it doesn't actually take it from the DNA, it makes a photocopy of the original document in order for it to follow the recipe and gather the ingredients to make the proteins that it requires. And this is how this is the premise of the mRNA-based vaccine, which is you find in your Pfizer and your Johnson & Johnson vaccine. So once that happens, so what the vaccine has done is what scientists have found a way to do is they have taken the coronavirus itself and through extensive analysis have unraveled its genetic material, read the codes and read the sequences that are there, and through a lot of experimentation found the specific combination and the ingredients that make the spike protein. And the spike protein is the basis of what the coronavirus vaccine is about. So they found a way to make the spike protein, and then your body is now, that is what we're going to be creating when we vaccinate you. So you get your mRNA-based vaccine, the mRNA strands that will then go into your body and into your cells will then not consult, because remember, we already have an mRNA, we do not have to consult the DNA. So what the mRNA strands that you get from your vaccine will do is they will enter the cell. They will not interact with your DNA at all because it's already a photocopy that has been genetically engineered by scientists. It will then go to your factory, your manufacturing plant within the cell and submit that document, and your factory making cell will then take all of those ingredients and put them together to make the spike protein. So it's not making the entire coronavirus because that's then going to create a problem, but it creates the spike protein only. And there's a specific reason why. Once your body then creates, the cell then creates the spike protein, the cell goes, all right, I've made the protein that you've requested. It then sends the protein outside of the cell, and the spike protein will then sit on the surface of the cell and wait there for what happens next. And that's then going to be that your body will then have your immune cells, which you'll see over there. And in the diagram, there's one cell that's got specifically blue dots, and that is a cell that now is presenting the spike protein in the body. How your body responds to this is your immune cells, so that purplish and that pearly looking cell rolling around in your system will identify cells with the spike protein, and then will send a signal that that's not normal, that's not supposed to be there. Once it does that, your body will then start reading that spike protein and creating cells that will destroy that specific cell with these spike proteins. Once the body does that, it then says, all right, if there was one cell that has a spike protein, there might be more. Let's go hunting. So your immune cells then generate a lot more cells that are going to go and find and scan the rest of your body to find these cells. And that's that's how basically in a nutshell you get your antibody cells. Once you have your antibody cells, they will then, while they're freely circulating in your body, will identify any and all other cells that contain a spike protein. And they will surround that, blocking those cells from interacting with your cells, and also sending a signal to your immune cells to destroy that specific cell that they have identified. And that becomes the basis of the coronavirus vaccine as to how it's actually working in your system. Your immune cells will then, while they're circulating in your body, then read the signal of please destroy the cell, and they will ingest and destroy the coronavirus or even these spike protein containing cells. And then you will pretty much have then what we want, and that is your body fighting against the coronavirus. What is the goal of vaccinating? I think that's also something that we have to talk about. So from there, the goal of vaccinating, it's important for us to mention that vaccinating against coronavirus at this point in time is not actually to prevent you from ever getting coronavirus. That's not possible, as it's a very new virus. We're still working on it. Scientists are working extremely hard to try and code it and decode it and find a permanent solution for it. But actually, what we're trying to do at the moment is to prevent individuals who acquire coronavirus from developing severe COVID disease in an individual that has coronavirus. And it's to reduce the risk and the need for individuals to be hospitalized and receive intensive medical care for their COVID virus infection. If we're going to look at that a bit more, go into it a little bit more. If you look at the spectrum of what happens when you have coronavirus, you have people who are asymptomatic, have no infection, or you have no infection at all, you're a normal, healthy human being. Then you have your infected individuals who have no symptoms, and it ranges from moderate to severe to your hospitalized critical patients, and a large amount of those people, some eventually die. Not all of them, but a large portion of the hospitalized patients do not survive. So the goal then of vaccinating is not necessarily to get you COVID, to stop you from ever contracting coronavirus, but it's to prevent the need for you to be admitted into a hospital and to circumvent death. So ideally, in the ideal world, our intention with the coronavirus vaccine is for you never to get COVID. Similarly, like we have in children, your polio vaccine and your diphtheria vaccine as well, which are things that we no longer see in our world. They only exist in textbooks and laboratories now, because through years of work, scientists have found a way to ensure that it never happens. So the goal, ideally, in the near future, we hope, will be that once you receive your vaccine, you never get infected with coronavirus. But currently, the goal is to give your body a head start in terms of generating antibodies so that it can circulate and identify problems, and it can identify pathogens and identify the spike protein that is on the surface of the coronavirus, and start dealing with it and destroying it before it causes significant damage and destructive severe symptoms in an individual. So the reality of it is that your vaccine is not necessarily going to prevent you from acquiring coronavirus, but it will assist that in the event that you do get coronavirus, your symptoms are limited to mild to moderate symptoms, and you don't reach that severe point that requires you to go into a hospital. The most important thing, well, then we go into discuss now the Johnson & Johnson and Pfizer vaccine. The most important question that we've received, that I've received personally as well, is that which one is more effective? Which one is better? Because all of us want to get the best vaccine there is out there. In South Africa, the only two vaccines we have available are the Pfizer vaccine and the Janssen vaccine made by Johnson & Johnson. And so we're going to talk about that just a little bit. I want to give you some information that will allow you to dispel the myths about it as we move forward. So the media was very, very active in telling us which one is better and which is less effective, and, you know, giving us statistics that, while they were true, they are not complete. It's important to note that if I've given you half of the information, I've given you information that drives a conversation that I want and not necessarily gives you all of the truths of the situation. So the media then publishes that the Pfizer-BioNTech vaccine has a 95% efficacy rate, and it scattered it all down until we got to Johnson & Johnson, which had a 66% efficacy rate, but didn't actually tell you what that means. And that's what we're going to do today. So looking at these figures, you're obviously going to think that Pfizer is more superior than Johnson & Johnson, but let's talk about what these figures actually mean. So when you look at this big diagram, there's a lot of information over there, so I've highlighted in red where your attention actually needs to go. When you look at the vaccines, the data that was published and scared the world was this information that was given here about the Pfizer and the Moderna vaccine and how effective they are as compared to AstraZeneca or the Sputnik vaccine or the Johnson & Johnson vaccine and what they do. So looking at it and the efficacy rates and what they say, yes, we're looking very scared and we're not wanting Johnson & Johnson. But what the media didn't tell you is that these figures and these percentages and these efficacy rates were generated from the phase 3 clinical trials of the Pfizer and the Johnson & Johnson vaccine. And this means that after the vaccine was made, they took specifically for Pfizer, they had 43,000 participants that registered in total in the clinical trial phase of that. And predominantly this trial was done in the United States of America, as opposed to the Johnson & Johnson vaccine, which was done large portion of it in the United States, but also a large majority of it in South Africa and Brazil. Then we look at important factors that happened around the time that the studies were being done and the results that they received and were published to the people. And that is what we see in this slide, is that if you look at this slide, it might slightly confusing, but it's okay, we'll explain. Looking at the timeline is when the study was, when we're looking at here, the new cases that were registered in the United States. And when the COVIDs were at their peak. So this is telling you in each week that is, it's a one trend week, and all of the months, we're looking at the amount of infections. It's per 100,000 people of what was happening in the country at the time. And you'll see that the Pfizer, BioNTech, and Moderna vaccine the clinical trial was run during the period of August and November. Also important to note that in America at that time is the summer period, is the hotter months, and where people are less likely to actually catch the common cold. Study was done then, and it produced those results then. As opposed to the Johnson & Johnson vaccine, the Johnson & Johnson vaccine was clinically studied in South Africa and Brazil. And when you look at the data that is published on these graphs, you see that during the time of the study of the Johnson & Johnson vaccine in October to January 2021, specifically in South Africa, there was a major spike in coronavirus infections around that time. And you look below that in Brazil, was also very scattered and it wasn't really reliable. And then you also then find that in South Africa, as well as in Brazil, new strains of coronavirus were identified during the time the studies were done with the Johnson & Johnson vaccine. Now, it's important to mention that. Why? That's because scientists have created a vaccine using the genome and the RNA sequence of the original strain that was isolated in Wuhan, China, and not necessarily the new strain that was identified in South Africa, or the strain that was identified in Brazil, or the new strain that is now being identified in the United States, and the Epsilon variant that is now being identified in California. They only created the vaccine using the genetic makeup of the original strain that came from China. Looking at that, in South Africa, then after Johnson & Johnson publishes their studies to say that it has a 64% efficacy rate, note that 67% of the patients that were infected with coronavirus, or 60% of the cases that were analyzed, those individuals were not infected with the original strain that came from China, from Wuhan, China, but actually the South African variant. And even with that, but the vaccine was effective in dealing with 64% effective. The vaccine was effective in 64% of the people that were studied in that trial, not dealing with just the original variant, but with also dealing with this new variant that presented in South Africa. That being said, it then goes to answer your question, simply put. Which vaccine is better between the two? The answer is there actually isn't one that's better than the other. We can't compare apples and pears. We need to compare apples and apples. And if we want to say one is better than the other, then we need to then do a clinical study of the Johnson & Johnson vaccine and the Pfizer vaccine in the same place at the same time, using the same people in the same circumstances. And then we can give you an adequate answer as to which one is better than the other. But that's not the case. So which vaccine should I actually get? Any vaccine is better than no vaccine. So whichever vaccine is available in your region and in your area is the vaccine you should actually get. Last thing we're going to look at before we go into the questions and answers are what are the side effects that I can experience when I get the vaccine. And the most commonly reported side effects of your COVID-19 vaccination are absolutely similar to the symptoms that you'll have when you had coronavirus. If you remember in the previous slide, we spoke about, in the previous slides in the beginning, we spoke about people having coughs, sore throats, fevers, tiredness, muscle pain. However, then with the vaccine here, you can have an anaphylactic reaction, which is an allergic reaction. And that can be quite severe, but it's the reason why your vaccine center has doctors and nurses and healthcare professionals there, and the reason why they require you to wait 15 minutes after acquiring your vaccination, so that if you do have an allergic reaction, it will present itself during that time and you can seek medical attention for it. However, it's not a very common thing that is reported, but it can happen. The most common ones that have been reported are pain and redness and tenderness at the site that the injection was given to you. People generally within 4 to 8 hours after receiving the vaccine complain of a slight headache, which is easily treatable by any of your over-the-counter anti-inflammatory medications that you can buy in a pharmacy. People did report chills and a fever within the first 24 to 48 hours. However, those fevers broke very quickly and they were not so significant that people are having significant major side effects. It was reported to be tiredness, and the tiredness onset is from 4 to 8 hours after getting a vaccination, and a mild cough, which presents itself usually the day after you have your vaccination and can last for 1 to 2, maximum 3 days afterwards. It's important to note that individuals who get vaccinated while they are in the incubation period of having coronavirus, or they are asymptomatic, if an individual such as that gets vaccinated, they can then present with severe symptoms and the actual COVID-19 symptoms. And you would think that because I'm vaccinated, I shouldn't get it. But that's not actually the case, because if we go back to the slide, we see that the Pfizer vaccine actually only becomes fully effective in your body 7 days after the second dose. However, the first dose is just as effective. And then the Johnson & Johnson vaccine reaches its full efficacy after 28 days of being vaccinated. So during the time, the 15 days prior to you actually getting vaccinated, you can contract the coronavirus and not have any symptoms, get your vaccine, and then you present with COVID. And people then think that they got COVID infection from the vaccine. That's not the case. They might have actually, most likely actually were incubating the virus and it hadn't really actually expressed. So that's all I've got to tell you guys. Those are my references of what we've spoken about today. And then from there, I'm going to then say, well, let's open the floor, or Alice will direct me as to how we're going to talk about it. And let's answer your questions and see what's happening in the chats. Thank you all.
Thank you, Sazi. Wow, very, very informative discussion there. I must say, reading and hearing about COVID from the news and from social media is one thing, but from a medical doctor's perspective, it's a whole different angle. And I truly appreciate you taking time and just giving us such informative information. We really, really appreciate that. Another thing I honestly appreciate is the emphasis you've put on the fact that if you are vaccinated, you can still get COVID. I've come across so many people who say, what's the point of getting vaccinated if I'm still going to get it? So I really appreciate that you've clarified that and why it's still important for people to get the vaccine. Thank you so much for that. I'm going to hand over to Sazi and to Fulani and Senzo to take us through the Q&A. Thank you so much for the comments and the questions in the chat box. I'm sure we have some on Facebook as well. So Senzo and Fulani are going to be directing those to you, Sazi, and you may then just address them to the best of your ability. Thank you.
Yes, thank you. Thank you so much again to Dr. Sazi. I think this has really been helpful, as Alice has explained. And I think a lot of people had questions, and we see the questions in the chat on Zoom, and also some of them really coming on our social media platforms. So we're going to try and get through them with the help of my fellow comrade, Mr. Baloyi, on the call. And then we'll try and get through them as much as possible. Just the first one on my side that I noticed coming quite frequently is the fact that for women that are pregnant, is this safe to have? I know there's a lady on social media that highlighted that she's 5 months pregnant at the moment, and then the husband got the vaccine and got some severe symptoms from side effects from getting the COVID. So the question is really, is it safe for pregnant women to really get like the vaccine? And then maybe we'll just ask them in group, and then maybe Dr. Sazi, you can just see which one to go for first. And then one that is again linked to that, I know a lot of people have also been asking about how does it affect the fertility of individuals? Does it cause infertility to men and women that are trying to have kids? And then the last one also just in the same group was, how does it affect the menstruational cycle of females as well? So a lot of questions have come and then you can see the concern really from there. So maybe give you those and then we'll give you the next group.
Sure. So that is a question that I was expecting, because it is a frequently asked one and is one that is carrying a lot of controversy at the moment. So the National Institute of Communicable Diseases states that women who are pregnant can still get the COVID-19 vaccine. However, there isn't actually any data that we have at the moment as to how it affects an unborn fetus and the unborn child. The reason behind that is because in the studies that it was done and in the clinical trials that were done, pregnant women were not included in the study. However, there are women who did get the vaccine who did not know that they were pregnant yet. So in that instance, we're still waiting to see what's happening or if anything adverse did happen. So the recommendation that comes from the National Institute of Communicable Diseases is that it's a risk-benefit ratio. So women who are working in high-risk environments, such as in hospitals, in the vaccination sites, in laboratories, or with crowds, those individuals should make the decision for themselves as to whether or not they want to get vaccinated. However, there isn't a global circular that says women who are pregnant should not get vaccinated. In terms of then the second question that you asked about the disruption of the reproductive system as well as the fertility, once again, in that department, we actually do not have enough data. The reason why we don't have data on that at the moment is because our aim and our goal and the intention at the moment is to get through the pandemic, is for this virus to curb it, to remove its teeth, and for it to stop infecting people and killing individuals. Thereafter, we can then start exploring and doing studies that then look at the effects of COVID in these specific settings. But at the moment, because it's doing so much damage, the first and most important focus is making sure that people stop getting infected and don't die from acquiring coronavirus.
Yes,
I
yes, thank
think-
you. Okay, you go, Mr.
Oh,
Fulani.
thank you so much. Dr. Sazi, there's a question that is related to, I can call it a diet or food. So this question is coming from Konziwe. She says, with the eating, are there any specific foods that could exacerbate the symptoms that one should refrain from? So I think she wants to know if there is any food that one should not sort of like find as him or herself eating.
No, there isn't anything that we haven't published any, doctors and scientists haven't published any information and any data as to food that you shouldn't be eating. You stick to your normal diet, you stick to your regular diet. What I can tell you that you should add to your diet during this time, which I believe everybody should be on, is a multivitamin. In the event that you are an individual who cannot handle or does not have the time in a day because of how and where you work to eat a balanced meal 3 to 4 times a day, then you should perhaps consider having a multivitamin to make up for the deficits that you go through during the day. But in terms of foods that you shouldn't be eating, there isn't any data that we've come out with to say this is the food you specifically should and specifically shouldn't eat.
Yeah, thank you. So another group of questions that we have are also linked. I'm sorry if I'm not calling out the names, so we're just trying to get the names from both platforms, but I do remember the questions that are presented. The one is, there was someone who's also concerned or just also interested in terms of like what components make up like the vaccine, what is included in the vaccine. And then there was another one in the chat that went on to highlight specifically that, is it true that the vaccine also contains, I think you might have covered that, like contains some type of like form of COVID also within the vaccine. I'm sorry if I'm not presenting it correctly, but to help yourselves to learn about the disease, that's what the person is trying to find out. If does it also contain some type of virus in order to help your immune system to learn about the disease. And then the other one was interested to find out whether, is it okay if you mix the 2 vaccines at the same time? I'm not sure if like they're trying to be extra safe. So you get the first shot of Johnson & Johnson, then you went on to get like the Pfizer vaccine. So that was the next group of questions, just all related to the vaccine. So over to you, Doc.
Okay. I think let's deal with the first one, which is really blowing my mind, is you really shouldn't get both vaccines. There's no real need. The reason why I say that is, remember that the strain and the genetic makeup that creates the RNA, the mRNA that was being injected into your body, it's the same code, right? So remember when we spoke about mRNA, we spoke about how it is a recipe book for ingredients for your body to make the spike protein. So Johnson & Johnson, Moderna, Sputnik, Pfizer, all of them have gotten the same recipe book. The only difference between them is who is making, the company that's making the vaccine. It's the same thing if you look at, if we try to make an example of using bread, whether I'm buying Albany bread or whether I'm buying BB or Sasco, I'm still buying bread. It's just that one loaf is made by Sasco, the other loaf is made by Albany, the other one is made by BB, but it's still bread. So the ingredients gone into it, the core ingredients of flour, wheat, and so on, are what makes the bread, which is the same for the vaccine, is that the genetic code that makes the mRNA for the vaccine is the same for Johnson & Johnson. It's the same for Moderna. It's the same for Pfizer and for Sputnik as well. Where it differs is the amount of sugar and salts and other binding proteins that the companies have used to create the liquid. But the basis of it is the same thing. So that then answers the question of, should I get them both? The answer is no, don't. If you've gotten the Johnson & Johnson vaccine, you're fine. Your body remember, is we're training your body to create antibodies. And once your body has created antibodies, your body will continue to create antibodies to circulate in your bloodstream in order for you to identify a potential coronavirus invader that comes into your system. So it's not that Pfizer and Johnson & Johnson will give you a different spike protein. No, it will be the same genetic code that will teach your body, your own body, to create the spike protein. I asked also then was, are they giving us a component or a portion of the whole virus? The answer is no. Sorry, I'm seeing something about my connection. Am I still fine?
Yeah, I think
You're back on now.
Yeah.
Okay, I'm back on now.
Yes, you can go ahead.
Okay, where did I stop?
No, it was just a little bit jittery, but we didn't lose much. So just go back to your last sentence.
Okay, good. So when you then look at, remember that we spoke about, so there's different types. I think it's important for us to then just have a touch on different types of vaccines. So there is a type of vaccine where they give you a weakened form of the entire virus. And that would be a weakened virus that we give to you. That's one type of vaccination that are available in the world. There is also another type of vaccine that gives you a killed form, a dead form of the virus, so your body can destroy that and create antibodies. That's another type. But that's not what we're doing here with coronavirus. With coronavirus, what they have done, what scientists have found a way to do, is to take the virus and introduce to your body the genetic code that helps your body make the protein that the coronavirus, which is called the spike protein, that makes the coronavirus interact and bind to your cells. So that's the only thing that the scientists have made and inserted into the vaccine, is pretty much the ingredients, the recipe book for your body to make the spike protein so that your body can destroy potential and future spike proteins that are circulating in your body. Does that answer the question?
Yes, I think it does. It does hopefully answer the question. If there's still more questions around it, we are trying to monitor the chats, and yeah, people can still continue to ask questions. So I don't know, Mr. Fulani, do you have more questions that you have picked up on your side as well?
Yeah, there is some of the questions that I think are still relevant for me to pose it to Dr. Sazi. So there's a question that I know you have addressed a lot of things when it comes, you have covered a lot of things when it comes to vaccine, but I think this question is also relevant, Dr. Sazi. So Chantel wants to know let me just read the question straight. What happens if I have received my first vaccine and then come into contact with someone who has tested positive? Do I still need to self-isolate? And let me just, again, there's another question that comes from Tumelo that I think is also important. What is vaccine made out of? So that one, I'm not sure if you can answer as well, but yeah, you can start with the one that comes from Chantel, and then you can address Tumelo's question as well.
Okay, so Chantal's question was then that if I have received my vaccine and I come into contact with somebody who has COVID, should I still isolate? Was that the question?
Yes, that is the question. And yeah, remember it's the first vaccine, maybe the first jab. Yeah.
First jab. Absolutely. So the answer is absolutely you need to. Remember that with vaccinating, we are not making you immune to coronavirus, but we are giving your body a head start in terms of we are training your body to identify the spike glycoprotein of the coronavirus, so that if you do get infected with the coronavirus, the virus doesn't have the opportunity to multiply and run rampant freely in your body, which will give you moderate to severe symptoms. But that when the coronavirus does enter your body can identify it immediately and start working on it immediately and destroying it immediately, instead of the catch-up process where your body then realizes that something is not right. And by that time, you have a full-blown spectrum of dangerous symptoms. Then the second question was that, what is the coronavirus vaccine made out of, as in the specific ingredients? That I'm not even going to lie, I haven't actually looked at it. I've actually only just focused on the main component of the mRNA vaccine and how it works. But you're welcome to then go on to the Pfizer website as well as the Johnson & Johnson website, and they'll give you a detailed breakdown of what types of sugars and what type of lipids and fats and so on they've used and what water they've used in order to create the vaccine.
Yeah, thank you so much once again. We do appreciate the clarification, Dr. Sazi. And then another round of questions that I've observed from the chat is that there's someone who's also asking there, like, if whether does the vaccine expire? Like, I know there were like talks earlier on in the year about like a certain time period of certain ones which must be kept at. So the first one was related, does it expire? And then the other person was asking actually, how many doses must you actually get? The others are saying 3 or 2 or 1. So there's also another question just around that. How many doses of the vaccine should you get? And then the last one was also just around some pre-existing conditions that people might have. I know someone was mentioning particularly pre-existing conditions that the person might have around diabetes, I think was one of them, and then others were asthma, I think. So is it safe for people that have pre-existing conditions? And one that is also just linked to that was that if someone doesn't have, has a flu or has COVID and then gets vaccinated while they have COVID, would that make it worse and result in death? I think that was the other question. Hope it's not a lot. So yeah, the other ones was just like, does it expire? The vaccine expire, and then how many shots, and then pre-existing conditions, and then like, yeah, I think those were some of the ones.
Okay, I'm writing them down because that's a lot of questions. Okay, so let's deal with the first one, and then how does it expire? The answer is yes, it does expire. So remember that it is a product that is made in a laboratory. It is a product. So just like all the other products that we have in the world, things do have an expiration date. Specifically because this vaccine, it contains sugars, it contains salts, it contains nanolipids, which is a glycoprotein, which is a fat. And those things over time, they're not necessarily going to get stale, but they will degrade. Okay, so there's a specific window. It's not necessarily, when we say it has an expiration date, it's not necessarily that the mRNA that is being introduced into your system will pretty much die or degrade. It's specifically talking, it's more actually talking about the other components that have been used to make the vaccine that also have a lifespan, because they're in their simplest forms. And as time progresses, those things do degrade as time goes on, which will mean that if you get injected with a batch that has expired, there is a risk that not all of it, you won't receive its full efficacy, or you won't receive any of it at all because of how it's going to get into your body and the protective mechanisms that it has in order for it to get into your cell. It might never reach there in the event that you get an expired vaccine. I'm not sure if that makes sense. Do you understand that?
thanks, Sazi. It does make sense.
Yes.
Yeah.
Okay, good. Then the second question is then how many shots should you get? So the Johnson & Johnson vaccine that's available is a one shot only. It's a one jab, quick and easy, it's done, and you don't have to get another one. The Pfizer vaccine has 2 jabs. So you get the first one, and then the National Institute of Communicable Diseases here in South Africa, the NICD, then recommends that 42 days after your first jab, you then get your second vaccination. So for Pfizer, it's 2 injections only. And for Johnson & Johnson, it's 1 injection only. There isn't a need for you to then get a 3rd or a 4th or a 5th vaccination afterwards, because remember how it works. And the goal is to create antibodies in your own body that will freely circulate, identify, and destroy coronavirus. So once you've achieved that and your body now has those freely circulating antibodies in your system, there's no need to start the process all over again. You will not generate a new response. The next question was that, should I vaccinate while having the flu? No. The correct answer to that, absolutely not. Remember that now we're currently vaccinating against the SARS-CoV-2 strain of coronavirus. Your flu is usually caused by other viruses that are not coronaviruses. It can be Haemophilus influenza, it can be Streptococcus. There's a different family as well that causes the flu. So if you already have the seasonal flu, what's happening is your body is expending all of its energy. It's creating antibodies to specifically deal with that infection that you have. So it's not then a good idea to then introduce another type of virus different to what your body's fighting at the moment, because that then splits your body's immune system. One virus will flourish and thrive because your body is specifically attacking one virus at the moment and will allow the other one unintentionally to flourish. So if you do have the flu, the recommendation is no, do not get vaccinated while you have the flu. Instead, wait 2 weeks to a month after you've had your flu before you get vaccinated. Why? It gives your body time to recover and regenerate immune cells and replenish all of the immune cells that have been destroyed from you dealing with the flu, and for your body to completely heal before you stress it again by having it make more antibodies for the novel coronavirus. The last question then in this series was then pre-existing conditions such as diabetes. Is it safe, and asthma, is it safe to get the vaccine? Absolutely, absolutely. So remember, when you have a comorbid condition, it pretty much means that you have a chronic illness that your body spends a lot of time dealing with. So in the presence of a person who is diabetic, your body is dealing with a lot of the complications and preventing a lot of the complications of your sugar being way too high in your bloodstream. What we've seen in South Africa is that individuals with comorbidities, so your high blood pressure, cancer, your diabetes, not necessarily your asthma, but then in other immune suppressing diseases, and people who are immunocompromised as well, is that when they have been contracting coronaviruses, they contract it and it does a lot more damage on their body. So the answer to that is yes, you should. You should, while you're healthy, while you're fine, whilst you don't have anything wrong that's going on and you do have significant comorbidities, go and get vaccinated so that if you do get coronavirus, your symptoms are not as bad. When it comes to then a thing, it's then very important to then say that in the event that you have questions, like a lot of questions, the best thing for you to do is to make an appointment with your family physician or your registered practitioner, where you can sit down with somebody who knows your medical history very well and knows how your body has been behaving very well, so that they can answer your questions specifically about your nitty-gritty concerns and your individual concerns specific to you about you vaccinating and getting the vaccine. And that's all.
Thank you so much. Thank you so much, Doc. Tivu wants to know, how does steaming help in fighting the side effects of COVID-19? And this one, I think, again, a question that comes from Tapelo. I've noted it here because I think it's also a good question. I will tell you now. Right, there we go. He says, you have alluded to most hospitalized patients are not actually making it. In your own opinion, would you advise people to consider a hospital as a last option? And then he was indicating this is a very difficult topic. So that's one he was just adding there, but he wanted to know, would you advise people to go to the hospital? Those are the two questions.
Okay,
Can I
that's
pop in
fine.
quickly? Sorry, Sazi. Because of time, I'm going to ask Senzo if there's something, if there's a question that really stands out that we can then take as the last question after this. Just in the interest of time, it seems people are very interested in this topic. We may look at hosting version 2, of the same webinar. So over to you, Sazi.
Thank you, Alice. Okay, so yes, I've alluded to people not making it and that individuals who are hospitalized are absolutely sick. The question was, should we go to the hospital? That's it's very easy to answer that question. And the answer is, if you are not struggling to breathe, don't go to the hospital. What's happening in the country at the moment is everyone who has people who are infected with the coronavirus are panicking, and they're running into the hospitals and they're overcrowding the hospitals. And then what happens is people who actually need admission don't get it because the beds are full. Remember that we don't have enough hospitals to accommodate every person in the country. So it's important that if you find that your symptoms, if you do get coronavirus, if your symptoms are very severe, you're struggling to breathe, you're extremely exhausted, the most important one is you're very short of breath, then you go to your hospital. In the hospitals, also the doctors themselves are not going to admit an individual with mild coronavirus disease. Instead, that person who's come to seek medical attention in a hospital and didn't go to their clinic or go to their registered practitioner, all you're going to effectively do is take away precious time from critically ill patients. You must also remember that hospitals at the moment are not just housing coronavirus patients. There are people with other more deadly and much more serious problems now in hospitals as well. You've got individuals with very, very, very weak immune systems from chemotherapy, from your cancer patients. You've got individuals who have untreated cancers. You've got people who require emergency surgery. And when you come into a hospital and your symptoms are not severe, what you are effectively doing is you are putting those other sick patients at risk of contracting the coronavirus. So my recommendation for you there is, if your symptoms are mild and if your symptoms are not getting you to a point where you cannot breathe, where you're short of breath, where you cannot execute basic life functions, stay at home. and you can go to your clinic, or you can call your doctor and seek medical advice and seek medical attention. You can get a friend to go to a pharmacy and get your medication. The time when you go to the hospital is when you've tried it all. You've taken the Panados, you've drank all you can drink, you're hydrated, you're breathing, you're exercising, you're sleeping prone, and all the other recommendations that you're having, but you're struggling to breathe and you feel like you cannot get any air in. That's when you go into the hospital to go seek medical attention. And that's when you'll get admitted, because then you no longer have mild to moderate COVID disease, you have severe COVID disease. That requires you to be hospitalized and for us to provide you with supplemental oxygen while your body deals with coronavirus. The other question was, how does steaming help? I'm not going to lie and say I know, because I don't. Steaming it's one of the home remedies that individuals have been doing for years. It's not something that's been very studied. It is thought that because you're breathing the humidified oxygen or the humidified air from the steam, that it goes through and it opens your respiratory passages a lot more. That is what is thought to be the process that works. So individuals have been steaming with just water and have been fine, but there have also been people who have been steaming with just water who have not been fine. There are people who've been adding other things to their water, to eucalyptus, they've been adding Vicks. There's been horror stories as well of things that are being added to the water to steam with. But the thought process behind it is that inhaling the steam just assists your body in moistening your respiratory system, which will allow you to cough up more of whatever is obstructing your system and just open up your respiratory passages slightly more. I hope that answers the question.
Yeah, I think it does, Dr. Sazi, and thank you so much once again for your time. And yeah, there's still like
sorry to cut you off. I just popped into my mind now that it's very important for me to caution you that if you are going to steam, if you're going to do it, please do it correctly and do not expose little children to it. We have had major incidences where people have burnt themselves, where people have burnt their respiratory airway, their airway, people have burnt each other from steaming incorrectly. If you're going to do it, please read up on it first. Please consult somebody who does it and do it properly, because it can be extremely dangerous. It can subject you to third-degree burns, third-degree inhalational burns as well, which will put you in a lot more trouble than what you were trying to achieve. And whatever you do, do not steam children. Don't do it. Just don't do it.
Yeah, I think that's clear as daylight. And thank you once again, Dr. Sazi. Yeah, there's still a lot more questions that we have, but yeah, I think time is the factor.
Absolutely.
So I think the one last big question out there I'll just maybe select. I know there was also a question around like the vaccine containing microchips for the government to track people. Can you confirm whether that is true or not?
I was expecting that question. Okay, so we don't necessarily know how we got to this microchipping process. We don't necessarily know how that rumor started, but it is in fact false news. That I can absolutely confirm. It is false news. Perhaps we thought that maybe because we've used the word nanolipid, that people associated the word nano with technology, like nanotechnology, which is what we're currently doing in the world, where we're making things smaller and smaller and, tiny and tinier, and using nanotechnology to do things. In this instance, the word nanolipid is literally describing the size of the protein, of the lipid. That it's just a microscopic, it's a medical term, scientific term really, to describe the size of a protein that we're making, and that's a nanolipid, or the fat that is encasing the mRNA vaccine. But I can absolutely confirm to you that there is no microchip that is going to be inserted into your body for it. And we are in a beautiful country. So if there was a microchip that was inserted, don't worry, it'll be offline by Monday.
Like that.
I'm kidding. All right, but there's no, definitely, absolutely not. We cannot introduce a metal into your body. That would cause serious complications to any human being if we take a metal and shove it into your cells, and could potentially kill you. And that would also be highly illegal to do that. So no, there are no microchips that are going to be put into any person without first their express permission to do so. And if there was one, you'd be told that there's a microchip inside. Okay.
Thank you, Sazi.
Very
thank you
welcome.
so much. I mean, I really appreciate how much clarity you've tried to give on this topic. I think we can tell there's a lot of interest and a lot of questions amongst us as the youth. And I guess that is the reason why we haven't been going to the vaccine centers to get vaccinated. So I'm hoping this webinar is just giving clarity and helping us to make up our minds and go vaccinated. I'm vaccinated, by the way, just so you know. So from the vaccinated gang, please go do it. I didn't have any side effects, luckily, except for a little pain on the injected spot. So if you're worried about anything, I mean, I'm still sitting here, so that should be motivation enough. Like I mentioned, guys, we have special messages from special people. So we're going to play you a short video just as encouragement and why it's important for us to be vaccinated. And we are the youth of this country. We need to take care of ourselves and our country. We're going to play you a short video now. There's no volume, Senzo.
Just give me an indication now.
Hi, everyone.
Oh, good, thank you.
I hope that you're all getting ready to go and get your vaccinations done. I'm very, very fortunate to be one of those older people who've now had both their vaccines. And so I hope that you guys are also getting ready to go and get your first vaccinations done and move on to your second ones so that you can do whatever it is that you need to do. All the best, get vaccinated and get healthy. Cheers.
Hello guys, how you doing? This is Julius, aka Dragonus Kim Sam, under Cyril Ramaphosa Foundation. Our message today goes to you, youth. We would like to encourage you guys to go and vaccinate. Please go visit your nearest vaccination site and vaccinate. The government is urging you, Cyril Ramaphosa is also urging you guys to go and vaccinate. And if you're not sure what does the vaccination do, please research. Do your Googling, do your research, and it will tell you everything that it can do or how it can help you and also the people around you. So if I were you, I will visit the nearest vaccination site and vaccinate. So please do go, and also don't forget to wear your mask, sanitize, and also keep your social distancing. We love you guys. Let's go and vaccinate. Yeah.
Greetings, everybody. Hi, I'm Danny K. And I was driving along, minding my own business, and beep, beep, my phone goes. And guess who it is? The Cyril Ramaphosa Trust. Yes, when the President's Trust sends you a message, you got to do the right thing and answer. And what has the Trust asked me to do? Well, deliver a very simple message, the importance of vaccinations for you, the wonderful youth of our country. We all know the loved ones, the vulnerable loved ones we may have in our lives, grannies, grandpas, parents, anyone older, people with comorbidities. And I really think it's our obligation, it's your obligation as the youth of this country to do the right thing and get vaccinated so we can put a stop to COVID-19 in our lovely country. Do the right thing, get vaccinated, be safe, be blessed.
Great. I hope you enjoyed that. I hope you feel encouraged. If you still have questions, please visit the official website, because there's a lot of information on social media that is not necessarily true. So please just visit official sites for more information. For those who are familiar with the Zlto platform, you'll be able to earn some points for attending this webinar, because you're being a responsible citizen, you're educating yourself. So if you go on the Zlto platform, you'll be able to earn this as a task and earn some points and redeem vouchers and whatnot. This is the end of our webinar. I'm going to hand over to my colleague, Kenelwe, who's going to give us a vote of thanks. Thank you so much.
Thank you, Alice. Thank you, everyone. So as Alice said, my name is Kenelwe. I work for the Cyril Ramaphosa Foundation. So on behalf of the Cyril Ramaphosa Foundation and on behalf of Cyril Ramaphosa Education Trust and Zlto, we'd like to thank you all for attending this informative webinar and for your participation and engagement. It's really been encouraging, and we hope that you guys have found this session to be useful and insightful for you. A big thank you to our wonderful friends who are kind enough to send videos of encouragement. Puti Mahanyele Dabengwa, who is a board member of the Cyril Ramaphosa Foundation and the CEO of NASPA South Africa, as well as Julius Hole, who is an actor and a motivational speaker, and musician and activist Danny K. We're also really grateful to Dr. Sazi Nzama, who is a CRET alumni, for his time and presentation on this important subject. I think from Dr. Sazi's presentation, we have learned that it's crucial to make informed decisions, which is why we decided to hold this webinar to provide factual information. I think what we've learned as well is that, you need to make an informed decision. The information that you're getting, you need to be getting it from experts. You need to be consulting with people that you trust and getting information from reliable sources, because we do know that in this time and age of the digital media, it's so easy for fake news to be spread around. So we really hope that you guys make some informed decisions. I'm just going to share my screen with some details about registration for those who are interested in registering for the for vaccination. These are some of the options that are available for you. You can register via WhatsApp. You don't require internet access or data. You can register on the EVDS system and various other options that are available to you. So yes, thank you, everyone.
Perfect. Thank you so much, Kenele, for that. Thank you to all our attendees. I think a lot of people actually stayed right until the end. Yes, please, Sergio, you can screenshot this last screen with the correct links, for the correct information and to register for a vaccine. We are hoping that a lot of you will be vaccinated after this. And if you feel that there's a need to continue having these discussions, please engage with our social media pages and we'll be able to connect from there. Thank you so much, everyone. And we will end the event. Thank you.
Thank you. Bye-bye.
Bye.